Hi, everybody. Looks like it's noon, so we'll go ahead and get started. First of all, I want to thank you all for joining me today, especially last minute notice that we gave you. I don't know if you've noticed, but it's getting a little intense out there, right? Can you all hear me? Yeah, Jerry, thank you. Okay. Getting intense. Yep. So I wanted to get everybody together just to talk about COVID-19 and to also provide you with some updates. If you have questions while I'm talking, I know everybody is muted. I'm not planning to unmute, but I would like for you to type questions into the chat. And what we'll do is try to gather those questions and send them out. If you don't want to type into the chat, that's fine. Send them to your ARD or your RDO. We will gather up those questions and try to put out an FAQ fairly shortly, just to try to address things as they come up, very timely. There is so much information out there on this virus, and a lot of it seems to be changing. I want to say daily, but I'm going to say hourly, right? I mean, every hour it seems like something else is coming out. And I wanted just to keep you guys up to date with what we're doing out here at Infinity, also a little bit about Avamere and Prestige. You know, we're very involved with them as well. But what are we doing to really keep our arms around this so that we can inform all of you and try to be a good clearinghouse of information so that you have the best information as timely as possible? One of the things that we started just this week is a daily command center meeting that we're doing every morning at 7:30, and it's the leadership team of Infinity Rehab, as well as that includes your area rehab directors. It also includes Carl Tabor from Avamere. He's our EVP of Clinical and Quality, and a nurse, and so really good quality information from him. I don't have her on the call, but the Signature president, Mary Kofstead, is a nurse practitioner and somebody that I trust and is very respected in the industry. I have been having daily calls with Mary Kofstead as well. I am not a nurse, and I really value their information, and I'm checking what we're saying to the field with those two, because I want to make sure that it is very clear and that it's accurate. We have 2 Infinity Rehab facilities in the Seattle market that actually have confirmed exposure to the virus. Several of our staff are actually quarantined today in Western Washington in the Seattle market. These experiences are tragic for our patients and their families, and they're troubling for our staff working in these locations, and they're troubling for us trying to help navigate and guide these therapists and their families through this process as well. We have gained insight, however, and we've developed tools in order to be able to assist all Infinity employees. So even if this virus is not in your area and you are not in the hotbed of Seattle, we want to make sure that if it moves to your location, that we have tools and support available to guide you and really help you to navigate through this time. I want to thank Susan Churchill, who's the ARD in the first building that had the virus in it in our locations. She started immediately creating forms and tools and processes when she first got word of the infection in one of her buildings, and we're really using those tools to start moving forward, so thank you. I also want to thank the frontline clinicians and staff in those 2 locations that have the virus. You have been incredibly patient, and you've been excellent in the face of this challenging time, so thank you. We very much appreciate you and everything you are doing. And I told one of the staff that I spoke to, but our hearts are with you. You are on our minds, and we are continuing to just work on resources to support you, as well as potentially in the future, as we move through this, the rest of our staff. And to that end, we are creating resources for our directors of rehab, our OPCDs, and our home health coordinators, so that you can get this information to your teams accurately as it evolves so rapidly. we have created folders on the Springboard. We think the Springboard really is the tool that most of you use the most consistently. So under the DOR resources, as well as the OPCD, I said that wrong, resources tabs, there is a new folder that's labeled COVID-19, and it has updated information for you. A couple of the things it includes: guidelines about exposure. There's a worksheet for our directors of rehab to use if they need to track employee quarantine, which is quite complicated. This form that Susan created really does help us to be able to track more effectively. There's also a great video in there about how to don and doff personal protective equipment safely. I do want to mention, give you a word about PPE. It is no secret that there is a shortage of masks and gowns in the industry right now. Masks are really, the mask use is being risk stratified in many of our locations. Whether or not you should be using a mask is based on guidance from your facility leadership. If I could urge a word of caution here, this is a stressful time for everybody. And people tend to go to their comfort level. When we're stressed, we do certain things. But I would ask for your patience and your understanding and some calmness in the face of these shortages. What I am worried about is some demand. If we're demanding from facility leadership in buildings that they provide us masks, that may not go over well, especially if it's a building that doesn't have any current outbreaks. So please be careful about how we're talking to our customers, to ourselves, to families in the industry. I have ordered for Infinity a couple of cases of reusable masks that once we have those, I will be distributing to our buildings. These masks are great because they can be used between patients, they can be used for multiple days, and so it's a great resource that we're going to have. The order has just been placed this week. Once we receive that shipment, we will get it out to you all in the field as quickly as possible. Another thing that we're doing here at the office, we have several people who are monitoring Department of Health websites in the states that we are in. So not just the Department of Health, but we're also monitoring the CDC website, the CMS website, and World Health Organization for any updates as they occur. And as you know, as I've said, they're occurring multiple times in the days just throughout the days that are happening. Which brings me to a topic that I'm sure is on all of your minds, symposium. We are going to be following the advice of the experts, and we are canceling symposium this year. Well, I am confident that this is the right thing to do. It is an extremely difficult decision to make because it is such a huge part of our culture. The DOR and the ARD meetings that are usually held right around symposium are also being postponed. We will reschedule at a later date, and we will let you know more about that as we know more about that. We're also really looking for ways to connect and perhaps even bring some education to the field electronically. So stay tuned, no promises, but wouldn't it be great if we could do something with these speakers that we had lined up for symposium? We are working through all of that right now. While I have you all together, I thought it might be worthwhile just to go through COVID-19, just as a reminder to everybody. I'm sure you all know this, so bear with me. But this is a respiratory illness, and it's spread from person to person by respiratory droplets. And it's between people who are in close contact to one another, and close contact is being defined as 6 feet apart. It also can live on surfaces for days, up to 10 days. I also just heard this morning, although I haven't verified it with my health experts, that it can live in water for 3 days, which is really interesting. And I know I've heard this through some church organizations that use water, that they're not doing it any longer. Symptoms can range from mild to severe, and they may appear as soon as 2 days after exposure or as long as 14 days after exposure. Symptoms include fever, dry cough, and shortness of breath. It also could include nasal congestion, runny nose, sore throat, and diarrhea. We do know that up to 80% of infected people recover without needing to seek any additional care. People with underlying medical conditions and the generation of patients that we treat, that we work with, are the highest risk, and they have the most devastating statistics around this disease. So I would again caution all of you, if you are sick, stay home. If you see a staff member, a fellow staff member come in sick, please send them home. Practice good infection control. Wash your hands, don't touch your face, cover your cough, stay home if you are sick. We are going to be releasing updated infection control training via CEU 360 to all of you. We ask that you take this training right away and sign the attestation that you have completed it. For our leaders in the field, DORs, OPCDs, home health coordinators, please work with your community, your very specific community, to determine if they have any additional infection control training that they want our staff to take, and please make sure that we are doing that. Some other practices to remind you of is social distancing. It's why we're seeing NCAA tournaments canceled. It's why we're seeing concerts canceled. Suspend group activities if there is a confirmed case in your facility. There should be no confirmed or no group activities occurring. If you have no confirmed cases of COVID-19, influenza or norovirus, please do move forward with business as usual. Group and concurrent treatment are still beneficial modalities for symptom-free communities. I would urge you to take the added precaution of 6 feet of space between patients as you're doing these activities. We do have some staffing lessons from Seattle I want to share with you all. As you're thinking about staffing patterns in your own facility, as you're thinking of sharing staff between facilities. Consistent staff assigned to a specific patient on the same unit or hallway is really, really critical. If a patient develops symptoms of the virus, if you've only had 3 staff members, PT, OT, and speech, treat that patient, it has limited now your exposure of all your staff members. Unfortunately, I think, we have practice patterns where lots of different professionals treat our patients, treat individual patients. And what happens then is all staff are now exposed and all staff become quarantined. That's something to think about. I'm not mandating anything with that, but I do want you to think about it as you are looking at your staffing and scheduling clinicians with patients. Today, several states are actually requiring daily temperature checks and screening of all staff as well as patients, and limiting and restricting visitors. Even if you're not in one of those states today, that may occur sometime in the not too distant future. Next week on Tuesday at 11:30 Pacific Standard Time, there is going to be another webinar with Pat Preston. We did send out that Zoom meeting. I think it was yesterday that we sent that out to you all. If you do not have that invitation and you're interested in it, please reach out to your leader and we'll make sure that you get that invitation. Pat is just a wealth of information. Many of you I know were on the first webinar he did here at the building, and it was just great information. So please join if you can. So finally, I just want to say we are all in this together. COVID-19 is an evolving situation. You all have such excellent judgment. Please do not be afraid to use your best judgment and consult with public health authorities if you have questions. Ask for what you need. When you ask for what you need and it doesn't sound right, please seek answers from trusted sources, including your leadership team. None of us have all of the answers right now. In fact, updates are coming in by the hour, and they change the way that we are looking at this cultural event. Please remember that this is what we do and who we are. We do need to practice precautions, but we also need to take care of people, and that includes our patients and ourselves. Let's keep calm, but remain focused and vigilant. And as much as you are able, try to be a non-anxious presence in a cultural moment of anxiety. I thank you all for joining me today. I am going to look at these chat questions and I'm going to add them to our frequently asked questions. I really appreciate your time. Stay well. Everybody go wash your hands. Thank you. Bye-bye.